Equally important are contraindications, which are reasons to withhold a particular treatment. For example, if a patient has peripheral vascular disease, impaired sensation, or certain cardiac conditions, applying specific therapies could be harmful. Other contraindications include open wounds, hypersensitivity to cold, or severe blood pressure issues. Always assess these factors carefully to ensure patient safety and avoid adverse outcomes. Even with appropriate indications, complications can arise if a treatment isn't applied correctly or if precautions are overlooked. Potential issues include skin breakdown, such as blisters or maceration, especially with prolonged moist applications. You might also observe changes in skin color, like a gray or bluish tint or excessive redness. In some cases, systemic effects like hypothermia can occur, highlighting the need for careful monitoring. A blister is a common complication we sometimes see, particularly if a treatment is applied too intensely or for too long. It's essentially a fluid-filled sac that forms on the skin, often due to friction, burns, or, in our context, excessive cold exposure. Understanding how blisters form helps us prevent them and manage them effectively if they do occur. Continuing our discussion on complications, it's important to recognize various forms of skin damage. This can range from localized blisters, as mentioned previously, to more extensive skin breakdown or even open wounds. These issues underscore the importance of proper technique, patient assessment, and continuous monitoring during any therapeutic application to prevent such adverse events. Maceration is another complication, often characterized by skin that appears softened, wrinkled, and whitish due to prolonged exposure to moisture. When using moist-cold applications, for example, if the skin isn't properly protected or the duration is excessive, maceration can occur. This weakens the skin barrier, making it more susceptible to further injury or infection. Finally, we must be aware of secondary effects like significant skin redness. While some mild redness might be expected, excessive or persistent redness can indicate irritation, an allergic reaction, or even a more serious tissue response. It's a visual cue that something might be amiss, prompting us to reassess the treatment and the patient's response to ensure their well-being.